Hi guys, welcome to Fast Coder 21 Medical Coding YouTube channel. The purpose of the channel is to help the people who are in need of medical coding reliable resources. If you are already subscribed to our channel, help your friends to subscribe. If you are visiting for the first time, then click on subscribe button to receive latest updates in the medical coding field. This channel is helpful for freshers, experienced coders, aspirants of AAPC certification exams, and AHIMA certification exams. If you have any other topics or concerns, please mention in the comment section. Please click on the like button to encourage and motivate us. Please watch until the end to gain in-depth knowledge about ICD-10 CM, CPT, ICPIX coding systems. As these Q&A sessions are very useful in live coding, medical coding interviews, AAPC, and AHIMA certification process. Guys, if you go to any interview or certification exams, kindly keep familiar with code books like ICD-10 CM, CPT, ICPIX, as our sessions will assist you in the process of interviews and examinations, but not an alternative to original interview process or any type of examination process. So today we are going to learn about cardiac catheterization coding using ICD-10 PCS and CPT, which is the most difficult uh, topic in the medical coding. So here we are going to make it as easy as much as possible. We hope you are able to understand this session and you will get benefit from this session. If you have any concerns or suggestions, please mention in the comment section. Guys, whenever we code any procedure, we need to know the indication for that procedure. So here our topic is cardiac catheterization. So we need to first we need to know what is cardiac catheterization and what is the indication for cardiac catheterization and what the physician will get using the cardiac catheterization process. So here our first question is, what is cardiac catheterization? Cardiac catheterization is a procedure in which a thin flexible tube, usually we will call it as a catheter, is guided through a blood vessel to the heart to diagnose or treat certain heart conditions such as clogged arteries or irregular heartbeats. So using cardiac catheterization, physician will send flexible tube, like we will call it as catheter, into the blood vessels, and he will find any type of heart conditions or clogged arteries which may create heart attacks, and if any patient has irregular heartbeats, cardiac catheterization useful to identify the cause for irregular heartbeats. Next question, why do the physicians perform cardiac cath? Cardiac catheterization gives physicians important information about the heart muscle, heart valves, and blood vessels in the heart. As our heart is composed of muscles, valves, and blood vessels, so which are more essential aspects in our heart. So cardiac catheterization is a common procedure done to diagnose or treat a variety of heart problems. For example, physician may recommend this procedure if you have irregular heartbeats. Usually we will call it as arrhythmia. A means irregular, rhythm means heartbeats. Chest pain, usually we will call it as angina or heart wall problems among other things. So these are the main concerns physician may recommend cardiac catheterization. What are those? Irregular heartbeats, chest pain or heart wall problems, and also cardiac catheterization may be done during the diagnosis of or treatment of. So basically here cardiac catheterization will be performed when a major procedure is also performed under major surgery. For example, if you take coronary artery disease, congenital heart disease, heart failure, heart valve disease, microvascular heart disease, whenever physician perform these procedures during the same session, physician may perform cardiac catheterization also, as cardiac catheterization is acts as a diagnostic as well as therapeutic. So whenever physician performing a procedure, initially he may need to check the heart function, so he will perform cardiac catheterization as a diagnostic procedure. Next question. What can a physician identify using cardiac cath? Answer. So we have few points to remember. What is the benefit of doing the cardiac catheterization? Exactly what physician looks in our heart. So using cardiac catheterization, physician will locate narrowing or blockage in the blood vessels that could cause chest pain, as we usually call it as angina. So physician will measure pressure and oxygen levels in different parts of the heartbeat. Like he will try to establish hemodynamic assessments. So he can see how well the heart pumps blood, right or left ventriculogram, using take a sample of tissue from your heart. Like he will take the same sample, usually we'll call it as biopsy. Diagnose heart problems present from birth. Usually the conditions which will present from birth, we will call it as congenital heart defects. Diagnosis heart valve disease. Examine the blood vessels for any type of blood clots. So using the cardiac catheterization, physician will get exact structure of the heart and function and pressure of the heart valves, and he may check how the heart valves are working to run heart properly. Next question. What are the other procedure can be done with cardiac cath? So along with cardiac cath, physician may done other procedures also. What we will learn here. Widening a narrowed artery with or without stent placement, usually angioplasty. Angio means placel, plasty means repair. By using a stent, physician will repair the blood vessels, narrowed artery or vein. So treating irregular heart rhythms with cold or heat energy. Usually we will call it as cardiac ablation. During cardiac ablation also physician care may perform cardiac care. Closing holes in the heart and repairing other congenital heart defects. Opening narrowed heart valves, like usually we'll call it as balloon valvuloplasty. Valvuloplasty means repair of the valves using the balloon. Repairing or replacing heart valves, like physician will use artificial valves to replace the damaged valves during heart valve surgery. So during all these procedures also physician may perform cardiac catheterization. So next question, what is coronary angiogram? Angiogram means like angio means blood vessel, gram is recording. So here physician will perform blood vessels coronary angiogram. Here physician will perform coronary blood vessels recording. So coronary angiogram is the test to check for blockages in the arteries leading to the heart. Here a dye is injected through the catheter and X-ray images of heart arteries are taken. Like heart arteries, usually we have coronary arteries only. So the dye helps blood vessels show up more clearly on the X-ray images. In a coronary angiogram, the catheter is usually first placed in the artery in the groin area or wrist area. What is cardiac ablation? So cardiac ablation is a physician uses heat or cold energy to create tiny scars in our heart to block abnormal electrical signals and restore a normal heartbeat. What is right heart cath? Right heart catheterization is the procedure which checks the pressure and blood flow in the right side of the heart. Here, a catheter is inserted into the vein in the neck or groin. The catheter has special sensors in it to measure the pressure and blood flow in our heart. So here, usually catheter is placed in the neck or groin area and it has special sensors which can measure the pressure and blood flow in our heart. Next question, what is balloon angioplasty? Angioplasty means repair of the blood vessel. Using the balloon, physician will repair the blood vessels. So he will, if blood vessel is narrowed, he will expand the balloon. Sorry, blood vessels. So here, balloon angioplasty is used to open a narrowed artery in or near the heart. So basically, balloon angioplasty is useful everywhere, not alone in the heart, like in our leg arteries. Also, a physician will perform arteries angioplasty if those arteries or veins are clogged. The catheter can be inserted in either the wrist or groin for this procedure. The catheter is guided to the narrowed artery. Then a smaller balloon catheter is inserted through the flexible catheter and inflated at the narrowed area to open it. Often the physician will also place a mesh coil called a stent at the narrowed part to keep the artery open. So basically in balloon angioplasty, physician will try to open the narrowed area using the balloon. So as soon as the balloon reaches the narrowed area, he will inflate the balloon, and sometimes based on the severity, he may put stent also in that narrowed area to prevent recollapse. What is balloon valvuloplasty? Answer. Balloon valvuloplasty is done to widen narrowed heart valve. So angioplasty means narrowed blood vessels. Balloon valvuloplasty means narrowed heart valves. As you know, we have aortic valve, tricuspid valve, like we have few valves in our heart. So whenever those hearts gets blocked, physician may perform balloon valvuloplasty. The placement of the catheter depends on the specific type of heart valve problem. So based on the heart valve damage, physician will perform balloon valvuloplasty. Here a catheter is threaded across the valve. A balloon is then inflated to make the valve open more easily. Next question. What is heart valve replacement? A catheter is used to implant an artificial valve in the heart to replace a narrowed valve. For example, a procedure called transcatheter aortic valve replacement uses a catheter to replace a faulty aortic valve. So usually we will call it as a TAVR, a transcatheter aortic valve replacement. Like using the catheter, physician will replace the aortic valve, which is a more common procedure in surgery. Next question. What are included in diagnostic cardiac cath? Diagnostic cardiac cath includes recording intracardiac and intravascular pressures, recording tracings, obtaining blood for blood gas testing, and measuring cardiac output. Cardiac output means how much the pressure exerted by the heart to the body organs. A number of other tests involve the insertion of cardiac catheter, but they are not classified as a diagnostic catheterization unless a separate procedure with a report including the measurement listed in the proceeding sentence has been documented. So now we can learn few topics related to ICD-10 PCS cardiac catheterization. So here, how do you code cardiac cath in PCS? So PCS classifies cardiac catheterization to the measurement and monitoring section. So here, physiological system, body system, and function device character 6 sampling and pressure. Here qualifier character 7 specifies whether the procedure is left heart, right heart, or bilateral catheterization. We have one example here. So here if we check 7th character, 8 means it is bilateral cardiac catheterization, 6 means it is right heart, 7 means left heart cath. Here we have few examples. Let us learn. A patient status post heart transplantation presents for a right heart catheterization and right ventricle endomyocardial biopsy with fluoroscopic guidance to evaluate cardiac allograft rejection as well as to assess ventricular filling pressures, pulmonary artery pressures, and cardiac output. Would it be appropriately separately report the right heart catheterization when performed during an endomyocardial biopsy in ICD-10 PCS? Endomyocardial biopsy means as our heart is covered by myocardium, so to diagnosis or treat any abnormality in the heart, physician may perform biopsy of the heart muscle also here. So in this case, the documentation supports coding the right heart catheterization as a separate diagnostic procedure because it was done to assess heart function, like what we check using cardiac cath, ventricular filling pressures, pulmonary artery pressures, and cardiac output, and not just as an approach to perform the biopsy. So here using the cardiac cath, physician will identify identify all the pressures inside the heart. So we need to assign the following ICD-10 PCS codes: excision of right ventricle, percutaneous approach, diagnostic, and Fourier 0, 2, 3, and 6 measurement of cardiac sampling and pressure, right heart, percutaneous approach. So here basically we have used two codes. One is for biopsy of the myocardium, and the second one is the right heart catheterization. As physician will physician has checked all the filling pressures of the heart. So here right heart catheterization is not performed for any procedure. So as here it is a standalone procedure. Next question. A patient with unstable angina underwent left coronary angiography, right coronary angiography, left heart catheterization with ventriculography, and insertion of a drug-eluting stent. Myocardial fractional flow reserve measurement was performed. Mean arterial pressure and mean distal coronary pressures were then obtained. Is the FFR reported when done with heart catheterization? If so, what could should be assigned? While not required, facilities may report a code for FFR done in conjunction with the cardiac catheterization if desired. So it is based on the facilities requirement and client requirement. So here we need to assign the following ICD-10 PCS codes: 4A0 33BC measurement of arterial pressure, coronary percutaneous approach for the FFR. We have one more question here. A 64-year-old man is admitted for a left heart catheterization, coronary angiography of multiple coronary arteries, and left ventriculography using low osmolar contrast. Findings from these procedures resulted in decision to perform a percutaneous transluminal coronary angioplasty. Usually we will call it as PTCA of two separate lesions in the left anterior descending artery. One lesion was treated with a drug-eluting stent and the other lesion treated with a PTCA only. So one is only angioplasty, means here physician will not insert any stent, and the second one is here physician used drug-eluting stent in one lesion. So among angioplasty and stent is the more complex procedure, as after the angioplasty only physician may insert stent. The codes are as follows here. First, heart catheterization, fluoroscopy left heart, fluoroscopy artery. Here the angiography and ventilography procedures are completed using fluoroscopy, which can be found on table B21. Cardiac catheterization, PTCS are done percutaneously using the fluoroscopy for visualization. Two codes are necessary to correctly code the PTCA, as one lesion was treated with stent and one without. So here one lesion was treated with stent and one lesion was treated with only angioplasty. So here we need to code two codes. Note that there were two lesions in one coronary artery. However, the guidelines specify number of sites treated rather than name or number of coronary arteries. Guys, until here we have learned the purpose of cardiac catheterization and indications and PCS coding of cardiac catheterization as much as possible. So please like, subscribe, and comment and share our channel link to your friends, which will motivate us to create more informative sessions. So guys, we have completed PCS now. Now we are going to start cardiac catheterization in CPT. First question, how many families of cardiac cath available in CPT? Usually we have two types of cardiac catheterization. One is for congenital heart disease and one is for other than congenital heart disease. So here we have mentioned one for all other conditions. Next question, for congenital heart defects, which series code we can use? For cardiac catheterization congenital heart defects, 93, 94, 95, 96, 97, 98 series codes we can use. We can find these codes in medicine, cardiovascular, cardiac catheterization for congenital heart defect subsection. Next question, what is the indication for right heart catheterization for indications other than evaluation of congenital heart defects? So, right heart catheterization in indication includes catheter placement in one or more right-sided cardiac chambers or structures like right atrium, right ventricle, pulmonary artery, and pulmonary veins, obtaining blood samples for measurement of blood gases, and cardiac output measurements, speak or other method when performed. So here the question is, when do we use right heart catheterization other than congenital heart defect? So whenever physician wants to check any abnormalities, physician may perform right heart, left heart catheterizations. Next question. Right heart catheterization does not include right ventricular or right arterial angiography. So next question. What is the indication for left heart catheterization for indications other than the evaluation of congenital heart defects? So the indications for left heart catheterization involves catheter placement in left-sided cardiac chambers like left ventricle or left atrium and includes left ventricular, left angiography, left atrial angiography, imaging supervision and interpretation when performed. Next question. What are included in cardiac catheterization 93451, 93461 other than for evaluation of congenital heart defects? So what are included in cardiac catheterizations here basically? So in cardiac catheterization, all road mapping angiography in order to place the catheter is included. Any injections for angiography of the left ventricle, left atrium, native coronary arteries or bifardograph listed as inherent to the procedure in the cardiac catheterization and imaging supervision, interpretation and report all are included in cardiac catheterization. So what are included in 93451 right heart catheterization including measurement of oxygen saturation, cardiac output when performed. The catheter is advanced through the inferior or superior vena cava into the right atrium, then into the right ventricle, pulmonary artery and pulmonary capillary wedge position for pressure measurements. Swine-Ganz catheter, a flow-directed catheter, should not be reported with 93503 insertion and placement of flow-directed catheter for monitoring purpose with any right heart catheterization purpose. Report 93503 when the Swine-Ganz is placed for monitoring purpose only. So, using right heart cath, we can't use Swine-Ganz. So, if it is only for monitoring, we need to use 93503. So to report right atrial angiography or right ventricular angiography, assign add-on code 93566, injection procedure during cardiac catheterization including imaging, supervision, interpretation and report. For selective right ventricular or right atrial angiography, we need to code 93451, 93453, 56, 57, 6061 and congenital heart defects disease catheterizations. So other codes that include right heart catheterization are 93453, 56, 57, 60 and 61. Do not report 93451 separately with any of these codes. Why means right heart catheterization included in all these codes. So we can't code right heart catheterization with 53, 56, 57, 60, 61. What are included 93452 left heart catheterization including intra-procedure injections for left ventriculography imaging, supervision and when performed. Here documentation should indicate crossing of the aortic wall and that the pressures are from inside the left heart chambers. Code 93452 includes imaging supervision interpretation for left ventricular or left atrial angiography. Other codes that include left heart catheterization are 93453 and 93582, 93461 series. Do not report 93452 separately with any of these codes. So left heart catheterization we can't code with the said code 93458 to 93461. Next, what are included in 93453? Here, this is a combined right and left cardiac catheterization. So code 93453 includes all left heart catheterization components, including the functions of the mitral valves, aortic valves, and aortic valve regurgitation. So if the physician performs combined right and left heart catheterization, so he is going to get all the details about left heart catheterizations and functions of the mitral valves, and aortic valve regurgitation. How do we code 93454? 93454 catheter placement in coronary artery for coronary angiography, including intraprocedural injection coronary angiography, imaging supervision, and interpretation. Here, basically, 93454 is for coronary angiography or coronary artery catheterization. So, here the coronary arteries arise from the aorta just above the aortic valve. So, the physician can place the catheter into the coronary arteries without entering the heart. So, here in 93454, physician no need to go into the heart to check the coronary arteries, as coronary arteries arises near to the aortic valve, where physician will insert catheter into the coronary arteries directly. When the physician uses injections for guidance only, do not separately code the injection. So as we have learned now, so we have catheterization codes for right heart, left heart, combined right and left heart, as well as the coronary artery. And here we have codes for bypass graft also, which includes 93455, 457, 459, 461. Next question. What are the common add-on codes we can use with cardiac cath? Like IVUS, usually we'll call it as intravascular ultrasound, supravalvular aortography, pulmonary angiography. So all these add-on codes we can code along with cardiac cath. Next question. What are included in cardiac cath? So these are defaults includes in cardiac cath. We no need to code separately. The following services are included in cardiac catheterization and are not coded separately. Local anesthesia and moderate sedation, insertion, positioning, repositioning, removal of catheter into the coronary arteries under left and or right heart, mapping angiography performed to place the catheter, recording of pressures in the heart chambers and blood vessels, angiography for closure device placement, evaluation and interpretive report. Do not assign a separate injection code for a type of injection that is already included in the catheterization code. So all these components are included in more comprehensive procedure as cardiac catheterization. We no need to code all these procedures separately along with cardiac catheterization. So here we have few examples. Let us try to learn using CPT coding systems. Example 1. A critically ill patient requires continuous cardiac monitoring. In the intensive care unit, a Swan-Ganz catheter is inserted into the jugular vein, so which is usually in the neck area, and advanced through the right atrium, right ventricle, and pulmonary artery wedge position. Usually, yes, here physician is going through the right atrium, right ventricle, and pulmonary artery wedge position means he is doing the right heart catheterization. So blood samples are taken, pressures and recordings are obtained. And the catheter is left in place for continuous monitoring for 2 days. Because here the answer is because the catheter is placed for monitoring only, correct coding is 93503. So here catheter is not for therapeutic purpose, here monitoring purpose only. So we need to code Swan-Ganz catheter placement. So next example, a 6 French sheath and catheter is inserted into the right femoral artery and a catheter is advanced into the left ventricle. So ventriculography means like recording of ventricles is performed using power injection of contrast agent. Pressures in the left heart are obtained. Additionally, the coronary arteries are selected and imaged. In this case, correct coding is 93458. Catheter placement in coronary artery for coronary angiography, including intraprocedural injection for coronary angiography, imaging supervision, and interpretation. With left heart catheterization, including intraprocedural injection for left ventriculography when performed for left ventriculography. So basically here in this code, so catheter placed in the coronary arteries as well as the left heart catheterization. So here we need to code 93458. Next example, a 7 French sheath and catheter is inserted into the right common femoral artery. The catheter is advanced through the inferior and superior vena cava into the right atrium, into the right ventricle, and then into the pulmonary artery. Directly, it is a right heart catheterization as superior vena cava, right atrium, and right ventricle. So, right side of the heart. So, here it is right heart catheterization. Next question. In what situations we can't use congenital codes? Answer. We can't use congenital codes if the patient's only congenital anomaly is coronary arteries, patent foramen ovale, mitral valve prolapse, or bicuspid valve prolapse, valve, bicuspid aortic valve. As these types of anomalies are very common, so these we will not consider as a congenital defects. So we can't use congenital codes to treat these defects. So how do we check document before coding cardiac cath? So basically the question is, so whenever we are trying to code cardiac cath, where to proceed? So initially we need to check with which side of the heart catheterization performed on the like right heart, left heart, or right and left heart, or only the coronary arteries. Next, when a study is performed for congenital anomaly, the right side of the heart will almost always be studied. So most of the times, if the physician is performing right side of the heart catheterization means patient might have any congenital anomaly. So usually congenital anomalies physician will perform right heart catheterization. So next topic we need to check what technique was used. Like retrograde. Retrograde means opposite the direction of blood flow. Retrograde approach is performed most often for coronary arteries and left heart catheterizations. The antegrade in the same direction of blood flow approach is more common for right heart catheterization. So if we see the retrograde in the operative report, we need to understand that physician is performing the left heart catheterization. So antegrade means so we need to identify physician performing right heart catheterization. So are there any add-on procedures we need to check either physician performing any add-on procedures along with the cardiac catheterization. So and also we need to check what are the place of service. For example, if you coding for professional component billing, modify 626 professional component or the hospital outpatient prospective payment system which assigns code to payable ambulatory payment classification. So if we need to check whether a physician facility or a hospital. If the physician performing this procedure, we need to add professional component to CPT code. So how do you code injections with cardiac cath? 93566 injection procedure during cardiac catheterization including imaging supervision. So all these are contrast codes, injections we need to code along with cardiac caths. 566, 567, 568. See here, lit separately in addition to the code for a primary procedure. Here we have a tip. Along with the appropriate catheterization code, we need to report an injection procedure for right atrial, right ventricle, aortic pulmonary angiography. We need to make sure to document the diagnostic codes to support medical necessity as with the prior codes append modifiers 26 when appropriate. So here we have few tips. So whenever physician will perform left heart catheterization, we have few tips we need to remember those. So for left heart cath, the report states the aortic valve was crossed. So means here physician is going across the aortic valve and he is going to the left heart inside the heart valves. Second one, there is an left ventriculogram is mentioned in the document. The ejection fraction is noted in the document. There is a LV left ventricular pressure in the document. So as all of us know, if the catheter enters the heart chambers only, physician may get the pressure. So here, if the physician mentions ventriculogram, ejection fraction, and left ventricular pressure, we need to understand that physician is performing left heart catheterization. So next one, what are included in left heart catheterization? Here also left heart hemodynamics, catheter placement in the left chambers, ventricular atrium, LVDP, diastolic pressures. So if we check our CPT book, we have very good information about cardiac catheterization. So we have tried to like encourage with you as much as possible. Even you can follow these guidelines here. Even we have few images also. This is for right heart catheterization. Right heart means usually physician will go superior vein cava or inferior vein cava. Through this, physician will insert the catheter. So here right atrium, here right ventricle, and from here it goes to the pulmonary artery, which leads to the lungs. So using right heart catheterization, physician will enters into the right side chambers of the heart and also into the pulmonary artery. So we have here left heart catheterization. Here a catheter is inserted into the arterial system and then into the left ventricle. So here using the arterial system, physician will place a catheter in the left ventricle. So here this is left atrium, this is left atrium, and this is left ventricle. So using the left heart catheterization, physician will diagnose any problems in the left side of the heart. So here 93453 combined right and left cath. This is for coronary angiography. So whenever the catheter does not reach aortic valve, we will consider this. See here coronary angiography without concomitant left heart catheterization. Here physician does not cross the aortic valve. So here it is only coronary angiography. This is not cardiac catheterization. Within the catheter does not cross the aortic valve into the left ventricle. So it is not a left heart catheterization. So here we have codes for catheterization of bypass grafts with right heart catheterization. Here also bypass graft, right heart catheterization, and here left heart catheterization with left ventriculography, left heart catheterization. Here also, here right and left, right and left. This is approach is different. Transeptal puncture. So whenever we code, we need to see this image here. So which is very useful. See here. For example, if we take 93451 catheter placement type. So whenever physician perform right heart catheterization, he will keep the catheter in the right heart chambers. RHC means right heart chambers. LHC left heart chambers. Here coronary artery placement bypass graft. So here in right heart catheterization, physician will perform only right heart catheterization. So here we can code 93451 and along with these are add-on procedures we can code along with the catheterization. So here we can code pharmacological study, exercise study, and injection procedure for selective right heart ventricular right atrial angiogram. So along with 93451, we can code 93463, 93464, or 93566. So this is for right heart cath. So this is for left heart cath. So as you know, left heart cath, we have separate approach, transseptal or transapical puncture. Here, this is self-explanatory, so we can learn easily. For example, if you take here, this is 93455 for coronary angiogram. Like here, only coronary arteries catheterization will be performed. For example, if you take this one, placement coronary artery, coronary angiography, injury. So here, coronary arteries will be catheterized, and here, right heart as well as the coronary artery. Here, right heart, coronary artery as well as bypass grafts. Along with all these three codes, we can use right heart catheterization here, coronary angiography here bypass graft catheterization. Along with these three codes, we can use these three codes. Guys, these are self-explanatory. Please have a research on this, which is included in our CPT book. This is very useful while coding. Guys, we hope you have learned small amount of cardiac catheterization here. We hope this session is very useful for you. Please like, share, comment and subscribe to our channel. If you have any concerns or suggestions, please mail at fastcoder21@gmail.com or please mention in the comment section. Our intention is to help the people and learn ourselves. So please keep watching fastcoder21 for new updates. Happy coding, guys.